let's talk about knee arthritis and what it is, and I'll start with what your diagnosis is. Knee arthritis is a condition where we lose our cartilage in our knee, and I kind of give this metaphor of a tire in the car. And so when the tire is completely worn out, the rim is rubbing on the asphalt and sparks are flying, and that's kind of the reason why you have inflammation. So the whole concept of inflammation in the knee, that swelling, is this friction that's occurring between the femur and the tibia, and that's what's causing the pain. You had a fall a year ago and it kind of got painful, and this kind of precipitated what's called an arthritic flare. So arthritic flare is this persistent inflammation that causes pain in your knee. So this begs, what do I do about this? What is the treatment? Most patients, they kind of, even before they see me, they talk about I've taken ibuprofen, I've tried to lose weight, I've worn a knee brace. So the first thing I always tell patients is that you can take an anti-inflammatory medication, and that's like ibuprofen, diclofenac, Mobic, that sort of thing. And if that doesn't work, the next step is injections, and there's two types. There's cortisone, which is an anti-inflammatory. So the purpose of cortisone in the knee is it's kind of like injecting ibuprofen directly into the knee. It brings down the inflammation, it causes a decrease in swelling, and it kind of can give you relief for up to 6 months. Have you had previous cortisone injection?
No, I haven't.
Okay. And then the second type of injection that they have is a hyaluronic acid injection, and that's a generic term. The type of company, there's different companies that provide it, like Suparts, Zimmergel One, Synvisc. They're all the same. It's a lubricating fluid. Basically, you're injecting the fluid that is in your knee, hyaluronic acid, and the concept behind it is that by injecting it, you're going to decrease inflammation by lubricating the knee. And that too can work up to 6 months. And I tell patients that this one can work in 4 out of 5 patients, whereas the cortisone injection kind of works in most patients. So it's kind of my second go-to type of injection before considering the last option, which is a knee replacement. And a knee replacement, I like to think about it as akin to when you go to the dentist and you have a cavity that they can't fill. They grind down the tooth and they put a cap on. And that's kind of the same concept behind a knee replacement. It's a misnomer that we're cutting out your knee and putting a new knee in. We're kind of resurfacing each bone. We're resurfacing the femur, resurfacing the tibia, and the kneecap. And when you do that, when you're replacing it with metal and plastic, when you do that, you're getting rid of the arthritis. So you don't have arthritis afterwards. And you had a previous knee replacement, and the main thing after getting the knee replacement is getting that motion. So once you get that motion, then the knee feels better and that pain goes away.